All right, good. Well, I'm sitting here with Esther Martin, who's been part of the Red Beard team for over a year now. And Esther, I just wanted to talk to you about what got you into body work and where you're headed with your practice and just chat in that way.
Yeah, totally. Yeah, I mean, I found massage. Um, Long story short, I had a really severe knee injury in my 20s. And somewhere along the line, I had this experience where I was really centered in my body, and I realized that an issue I was having after having this chronic pain in a knee was that my knee was literally afraid. Like my knee was the part of my body that was afraid of getting hurt. It was impeding my movement patterns, which was affecting my whole posture, like other chronic pain stuff. Um, and just that realization that that was held within my body was really eye opening and made me really curious. And then, like, some other friends of mine had gone to a program in New Mexico that sounded really interesting. So that's, I made that happen within a year of that experience with my knee in Albuquerque, New Mexico.
Yeah, very cool. So I think many body workers have some sort of origin story like that, something about, some question or some realization from their own experience that kind of drew them into the work. Sounds like you have a good example of that. Um, so you did that initial training in Albuquerque, and then what was sort of the next stage in terms of training and development?
Yeah, so massage is awesome, and I love how that's developed as my practice has grown. Um, I found a type of bodywork called visceral manipulation after my daughter was born. Um, in my pregnancy, I had some liver concerns, and maybe a year-ish postpartum to that, I found was referred to this practitioner who does this visceral work. And within just like a couple sessions, I remember maybe the first or second session with this practitioner, it was like I stood up and I felt like a snow globe. Like I felt like everything resettled, like little subtle things that I hadn't even recognized were somewhat like chronic strains and discomfort within my own body were just like gone. Um, and it felt like magic. There was, yeah, a couple times within the first few months of finding that practitioner that she just resolved something that like I had seen other, like a physical therapist, or I even at one time I just had this chronic pain in my left side, and my VM practitioner just kind of went in and like unhooked something, and it was gone. Like I had already had the CAT scan even because it was a pretty acute pain incident. But
Hmm.
what was adjusted was like a ligament that the spleen is attached to in the end.
Right. Well, so some of our audience might not know about visceral manipulation. Um, how so visceral referring to the organ system. I'll let you explain a little bit more. But what I'd especially like to hear is what's the difference between that and regular massage or myofascial release or something? What's the emphasis of visceral manipulation?
Well, it is the organs. It's interesting. In one of my first classes in it, it was explained. The institute I study with is the Barral Institute, um, and Barral is a French guy, so some of his translations come through the French language. And in French, manipulate means to care for with the hands.
Hmm.
So that is to say that we're caring for the organs with hands-on touch, right? Um, and so by following the lines of tension in the body and knowing a lot of study of the anatomy of the body, um, we are able to figure out which physical structure within the body needs a little bit of help to be softer, more aligned, more good at its job, right? That's a very
Yeah.
simple way. So in the when I'm doing that work with the client does wear clothes, but I most often will need the abdomen to be exposed. I will work with the client maybe lying down and seated, depending on what we're doing, and what structure we're working on, and what that structure is calling for to be done to assist it.
Right. Well, I think a lot of people would be surprised to learn that through touch you can influence the organs. But I don't have as much VM training as you. But when I went through the basic courses too, I was amazed at the degree of specificity that's possible, both in terms of palpating uh, the digestive organs, the heart and lungs, the reproductive organs, not only sort of sensing what they're doing, but the ability to um, help their movement, their motility, their mobility, things like that. I think a lot of people would be surprised that that kind of work is possible. Could you just describe a
Mhm.
little bit about
Yeah.
a couple of examples, like of how freeing the mesentery, or some of the things that you can sense and feel when you're doing VM work?
Yeah, absolutely. I mean, it's all part of it. One thing I will frequently work on is the liver, right? So
Mm,
we know, I'm actually, can I stand up? Do you mind if I just
sure.
stand up?
Yeah,
So
yeah.
our livers are kind of here on our right side, and they come all the way across, and
Mm,
they have a shelf attaching them to the diaphragm. But
mhm,
let's say that there's a bit of dysfunction, the liver's not moving as freely as we would like. Like if it
mm,
can't, maybe the left side is moving, but the right side is adhered for whatever reason, right?
mm,
So what that would take, the way that a visceral work could assist that is by applying very direct, specific force to the liver in the direction of that tension,
mhm.
which kind of allows the connective tissues to find their softness and find their flexibility, right? And that's the liver specifically is one that happens very frequently. It can be a reason for some chronic shoulder pain, just also sometimes like the breath not being as deep as we might like, right? So that's a very
Right. Well,
common
so
one to work on.
help make the connection, because so on the one hand, VM work could help with things that are relating to the organs, right? Like it could improve digestive flow, it could free up space, the way that the lungs or any of the organs are taking up space. So it can sort of, if and you're gonna check my understanding here, that we can benefit the functioning, the physiological functioning of the organs themselves, but not only that, because our viscera is attached to our skeleton and our connective tissue, that there's times when it's important to work with the visceral component in order to help free up tension patterns that are not even in the viscera. Is that a
Oh,
good is that a good explanation?
yeah, that's absolutely true. Yeah, like me think of another example. Oh, I've often worked on clients that are a good amount of time post a C-section, for instance, right? Or another larger abdominal surgery. C-section's a pretty common one. Um,
Hmm.
and so by quite often with that scarring, we'll see that things are being pulled downward and kind of to the front of the body, which
Hmm.
quite often that line of tension will be felt as like low back pain, kind of in the way it also kind of affects the whole structure, posture of the body when we're
Hmm.
being pulled kind of front of our pelvis. So when I am able to assist that client's body in releasing the scar tissue in the front of the body, quite often in just like one appointment when that person stands up, their back pain is significantly reduced.
Hmm. Hmm. Yeah. Yeah. Well, so then in a way you can see how, again, I think that the reason I touch upon that is I think it's good to know that visceral manipulation, it's systemic work. I mean, we're talking about the visceral contents, but their relationship to the body as a whole. What are some common, so you've mentioned back pain, shoulder pain, relating to visceral restrictions that you can help release. What are
Yeah.
some other kind of common complaints that would bring people in where VM does a really good job? Or what are some other situations that can be
Yeah.
helped with
Yeah.
visceral manipulation?
I mean, I personally have worked with people with swallowing issues, um, uh, down the line further, hiatal hernias. We can assist that that can get pretty acute, but we can definitely assist lessen the symptoms.
Hmm.
Um, SIBO can be assisted. Um, Again, this is more structural, but it can be structurally very, very effective at relieving some of the symptoms that can be chronic with some of those conditions. Post surgical stuff is a huge one, right? Like, there's tons of reasons why people would get surgery across their abdomen. And even kind of when an organ is removed, there's now a different shape to the rest of the structures within the body.
Hmm.
Um, and so sometimes the way that settles, the way the scarring goes between the layers of tissue that are cut through
Hmm.
when, let's say, a gallbladder is removed,
Hmm.
um, can need some assistance to not just be stuck. And we can work, kind of free them and let them move more softly against each other.
Nice. Um, well, and you're also, in addition to your VM work, you're at the beginning of your somatic experiencing training, and SE is one of the nervous system trauma therapy. That's very much a cornerstone of what we do here at Red Beard. I think what we have five or something SE people trained on our team, and happy that you're exploring that work as well. Tell us just a little bit about sort of how the nervous system fits in to the work you're already doing, and where you're going to be going with your SE studies.
Absolutely. I mean, one piece that's been foundational to all the body work I do is to kind of work towards moving people towards a parasympathetic state, the rest and digest. Um, that's
Safety.
Yeah, from the beginning of my bodywork training, that's like been where we are trying to move towards. That's where the body can heal.
Right.
Um, the way that fits into my understanding of how any healing work happens is that the client is the one doing more work than me, no matter what modality I'm working in. I'm
Mm,
just in my work day, right? But I'm not the person that's transforming.
mm,
Um, and to feel safe and calm within the body is where change can effectively happen. And I see that happen with massage and VM clients on my table within any given appointment.
mm.
Yeah, I'm always working towards people leaving my office with me, like being more comfortable than when they come in.
Mhm.
Um, so with the SE work, I can tell there's like an angle that I would love to build out, that's to kind of um, more digest fully the physical felt experiences with people. I can tell
Mhm.
that there's a place for that.
Mhm. Well, and coming back to your example of your knee, kind of talking to your or noticing the fear in the knee, and I'm sure in massage, in visceral manipulation, it's commonplace for you to, as you're working for somebody's, a connected emotional experience, or, get in touch with or release some fear or anxiety, or grief or something connected to something. And so I'm assuming you're already holding space for that. And SE gives sort of an additional layer of tools and a framework to really make those kinds of connections in a detailed way. So I wonder if that's sort of part of your interest as well.
Yes, exactly. I mean, yes, it comes up. Our bodies are ourselves, and our bodies, each part of our body feels a certain way about a certain thing. Um, and yeah, I would love more. I'm really looking forward to kind of building out my toolbox to help those things that come up be digested and worked through.
Mm,
I I do, try to communicate to the people I work with, um, that that's a real thing that happens. I know, um, it's not something everybody expects. Everybody kind of comes to that at their own pace.
sure.
But yeah, that's I'm looking forward to that.
We'll live it here. Folks can read your blog. We didn't get into improv, but they'll have to read your
Yeah.
they'll have to read your blog.
Mhm.
Yeah.